If your sciatica flares up every time you sit down, here's what you probably don't know. Your spine is collapsing. Not your muscles, not your hip, your spine. And it's irritating the nerves that make up your sciatic nerve. I've worked with hundreds and hundreds of people dealing with this problem. And the reason nothing you've tried has worked is because everyone's treating the symptom instead of the cause. So today, I'm going to show you exactly what's happening when you sit, why stretching and rolling don't fix it, and 2 exercises you can do right in your chair that actually take stress off your nerves. I'm Dr. Ryan Wolfert, and tell me if this sounds familiar. You wake up feeling okay, not great, but okay, and you're thinking, maybe today will be a good day. Then you sit down, breakfast table, your car, your desk, doesn't matter where, then within 10 minutes, that burning starts. Deep in your low back and your hip, shooting down your leg. You shift to the left, still there. Shift to the right, worse. Cross your legs, uncross them, lean forward, lean back, nothing is helping. And the whole time, you're thinking about what you're going to have to cancel today. What excuse you're going to have to give your daughter when she asks you to watch the grandkids, why you can't go to lunch with friends, why you need to leave church early again. At the same time, you're seeing people your same age on Facebook. They're hiking, traveling, playing with their kids and grandkids on the floor, but you're stuck, in pain, feeling like your body's failing you when everyone else got lucky. You've tried the stretches, you've been to physical therapy, you've rolled out everything you can roll out, and nothing's working long term. Here's why. Nobody's addressing or fixing the actual problem. You see, many times your sciatica isn't coming from tight muscles or weak muscles. It's coming from what happens to your spine the second you sit down. And I'm about to show you something that once you see it, you can't unsee it. Your low back is supposed to have a natural curve, this inward arch. When you're standing with good posture and upright, that curve creates space for all the discs and nerves in your spine. But as soon as you sit down, the pelvis actually tilts backwards. And when your pelvis tilts back, that curve in your lower back flattens out. Studies can show it can reduce by up to 70%. Think about that. You're losing 70% of your spine's natural position just by sitting down. Now, between each bone in your spine, you've got these discs. Think of them like jelly donuts. They're cushions that absorb shock and allow you to move. When your spine is in the right position and has that correct curve, those discs sit evenly. But when your lower back flattens from sitting, those discs can compress. And sitting right next to those discs and those bones are the nerves that form your sciatic nerve. 5 nerve roots exit your low back. They merge together and travel down your hip, your butt, all the way to your foot. When there's less room between the vertebrae, the bones, maybe from the disc degeneration or a disc bulge or a decreased low back curve, the nerve or nerves can get irritated and you get that burning, shooting pain. That's your sciatica, not some mysterious condition, not bad luck, not just getting older. You're actually squashing your spine every time you sit, and it's compromising these nerves. Your doctor tells you to take some ibuprofen, or maybe gives you a painkiller or a muscle relaxer. Maybe you do some hamstring stretches. Maybe you get adjusted. Your massage therapist works on your hip, and all those things feel good in the moment. You get temporary relief, maybe an hour, maybe a day, but then you sit back down. Your spine collapses into that same flattened position, irritating the nerve, and you're right back to where you started. You see, the medical system isn't designed to fix problems like this. They're designed to manage symptoms. Give you pills, send you to therapy, bill your insurance, repeat. But you don't need symptom management. You need to work on that curve in your lower back and retrain it to actually have a healthy curve. And you need to do it consistently. All right, so let's get into these 2 exercises that you actually can do. And you can actually do it right now while you're watching. The first exercise is called seated lumbar extension. Here's what you're going to do. Put both hands on your knees, your fingers gripping your knees for support. You're going to sit up tall, don't slouch. Now, you're going to pull your fingers into your knees while slowly arching your low back inward and forward and look up towards the ceiling. Your chest should stick out, your shoulders should go back, and you should feel that curve returning to your lower back. Hold that position for 5 to 10 seconds. Keep breathing. Please don't hold your breath. Then relax back to neutral. That's 1 rep. You can do 8 to 10 reps. That's a great starting point. Okay, 2 critical points here. First, this should not cause pain. If you get sharp pain or your symptoms get worse, you're going too far. Stay in the pain-free range of motion. We're restoring the movement. We're not going to force it. Second, if you look up and it makes you feel dizzy, just keep your head and neck straight and just move through with the lower back. Dizziness when you look up can signal neck instability, so don't push through that. What you're doing here with this exercise, it's the exact opposite of what your spine is doing when you're sitting. You're actively restoring the curve. You're creating space between the vertebrae. You're taking pressure off the spine, which takes pressure off the nerve. Now, the second exercise is a sitting hip stretch. And yes, it works your hip function while maintaining the healthy low back position. It's also a great exercise for hitting a specific muscle in the hip called the piriformis, and it sits deep inside your hip. And the sciatic nerve runs right next to, or even sometimes through, this piriformis muscle. When that muscle gets tight from poor sitting posture, it squeezes the nerve from the side. Now, it can be called piriformis syndrome, and it's incredibly common with sciatica. Okay, so here's the exercise. And I'm going to assume that it's the left side. You have left sciatica. So what you're going to do is you're going to sit in your chair, cross your left leg over your right knee so your left ankle rests on top of your right knee. Now, this is key. Sit up tall, chest up, shoulders back. Don't slouch around the spine or this won't work. Go ahead and place your hand under your left knee for support. And you're going to lean forward from the hips. Again, keeping your trunk and spine neutral and upright. You're not rounding the spine. You're bending from the hips. It's like you're trying to bring your chest or even your belly towards your left shin. You should feel a deep stretch in your left hip and glute, and that's the piriformis muscle. Hold for 20 to 30 seconds and keep breathing while you're holding. Obviously, if you have right-sided sciatica, you're going to want to do this exercise with the right leg instead of the left. Now, if this is too intense, here are a couple of modifications. 1, instead of crossing your ankle over your knee, just rest the outer part of your lower leg on your knee. That reduces the stretch intensity. And number 2, instead of holding for 30 seconds, you're going to do dynamic reps, where that means rotate your knee up towards your opposite shoulder, hold that for 5 seconds, then rotate it back down towards the floor, hold that for 5 seconds. And you can do that for 8 to 10 reps. But no matter what version you choose, you got to stay upright. The second you round your spine, you lose the stretch in the hip. Now, these exercises work, but if you want lasting results, you also need to change how you're sitting. So here are 2 simple adjustments I'm giving you as a bonus. First, you can get a seat wedge cushion, it's called, where it's thicker in the back and slopes down towards the front. So when you sit on it, it automatically tilts your pelvis forward and maintains your lower back curve. I'll provide a link below and you can order it online for about $20. Or if you want to test it first, you can just fold a towel or a blanket into a wedge shape and sit on that and see how it goes. Now, number 2, I want you to stop reclining all the way back in your chair. I know you want to relax, but when you lean back too far, your pelvis tilts backward and your spine collapses. If you need to recline, just keep it minimal, about 5 to 10 degrees. You can also use a small lumbar pillow behind your low back to try to help to maintain the curve that's there. Remember, you didn't develop sciatica in a day, even if it came on overnight. Your spine has been collapsing in that seated position for months or maybe even years. The discs have been getting compromised. The nerve has been getting irritated. This has built up gradually over time, so it's not going to disappear overnight. Will these exercises help? Yes, Most people feel relief right away. But if you want long-term correction, if you want to sit through a family dinner without pain, drive to see your grandkids without dreading the car ride, go to church without having to leave early, you have to do this consistently. I'm not talking about hours of work. I'm talking 3 to 5 minutes, 3 times a day, maybe morning, afternoon, at night. And here's the thing, you don't have to wait until you're in pain to actually do these. Do them proactively before your back starts screaming at you. Think of it like brushing your teeth. You don't wait until you have a cavity. You brush your teeth every day to prevent it. It's the same principle here. So here's what I want you to do right now. Do both of these exercises right in your chair all the way through. See how you feel. Then do them again tonight, and tomorrow morning, and tomorrow night. Do them every single day for a couple of weeks, just 2 weeks. That's all I'm asking. You didn't get here overnight. You won't fix it overnight. But if you're consistent, you will see the change. I get it. Sometimes you might need a little extra help. And if you want to go deeper, if you want to understand exactly how your spine and posture are affecting not just your sciatica or back pain, but your overall health, and get personalized recommendations for fixing it, just click the first link in the description and you can get a posture and mobility assessment no matter where you are in the world. You don't have to live like this. This doesn't have to be your normal, not even close, because you can be your own guarantee for your health and your life.